So I've worked at the university for over 20 years. I started off as a sessional and then worked into a full-time position. So even as a sessional, I was actually eligible for a lot of different types of benefits, which I really appreciated. And now as a full-time person, not only do I have the healthcare benefits, but also the different training opportunities, the different LDS conferences that I'm able to attend. So I've been able to professionally continue to develop.
When I first started here, I came in at a more entry-level position. I came from a private school. And so just along the way, anything that I've needed to advance my skills, it's always encouraged, and there's just that opportunity that I really appreciate.
I've been here for over 10 years now, working with an accounting background and also trying to get my certificate in accounting, both the advanced. And it helped to know that I could work full-time as well as study on a part-time basis. It helped to not take student loans, and knowing that your employer is able to provide you with that reimbursement and encourage you that education and the continued support.
When I started the job, my daughter had surgery shortly after I started, and the office staff and my supervisors were so flexible and so understanding with what it means to go through having a young daughter. She was 1 year old at the time. Have to go through something as traumatic, I guess, as surgery. If my daughter gets sick or has, if her daycare closes for some reason, I'm able to take a day to be with her to arrange for alternate accommodation for her.
Every year, somebody in my family, like one of my kids or myself, needs new glasses, for example, and just being able to not have to worry about coming up with that extra money or any other major medical expense that we need, it's amazing to have that.
My husband's plan, my parents' plan, none of the other healthcare plans that I'm aware of have something so flexible to be able to cover medical-related expenses that aren't typically covered under a healthcare plan, and I've certainly made use of it.
For new researchers, there is a quite significant new support. First is the startup grant, which Vice President Research Office provides on a matching basis with the unit, so the faculties or schools. Also, the new investigators can apply for a university research grants program, and they are eligible to apply for 2 grants in the 3-year period. At the same time, if they are in a faculty which is a social sciences and humanities research council eligible, in addition to URGP, they can apply for SHRC and travel grants program. Researchers hired in the creative faculties can apply for the creative grants program. In addition to that, new investigators are provided opportunity to attend a lot of workshops on grants writing. They're also provided assistance in terms of developing their grant applications. Some of that assistance comes through ORS, Office of Research Services, and some comes from the grant facilitators, as well as the associate deans research in their units and the department heads.
Just knowing that I am part of the office in helping other faculties to gain new researchers and to make the research portion of the university just grow bigger and bigger.
I also really appreciate that within the office, we do more informal things that I see as a benefit. We get together for potlucks, so we get to know each other on a more personal level. We also celebrate birthdays. Again, get to know people outside of just the work environment. We get to know a little bit more about them and see them as people, which really I find helps to build a warmer work environment. So to me, even though that's not a benefit that would be listed anywhere, it really is a benefit that you get to become friendlier with your staff members.